Good morning. Role of specialized nutrition and role of critical nutrients in pregnancy. Today, I'm going to talk beyond protein and calories. There is need for specialized nutrition for a pregnant woman. Nutrition, both before and during pregnancy, induces long-term effects and has an impact on child's long-term health. Addition of multiple micronutrients to a balanced protein and calorie diet among women with inadequate nutrition has seen to increase the child's birth weight significantly. The next question is, what are the critical nutrients needed during pregnancy? Beyond protein and calorie, there are 5 essential nutrients which are required for a pregnant woman. The first and most important is folic acid. Folic acid supplement is recommended not only during pregnancy, but it should start before pregnancy starts. All women who become pregnant are advised to take a folic acid supplement 400 microgram daily, and it should be continued for 12 to 14 weeks. Folic acid prevents congenital abnormalities, especially abnormalities of the neural system like spina bifida, or also defects like anencephaly where half the brain or head does not form. It also prevents anomalies of the heart and some other anomalies like cleft palate and cleft lip. And therefore, it is a very, very important nutrient in the first 3 months of pregnancy. We come to the second important micronutrient, which is iron. Now, iron requirements are increased during pregnancy, so the demand on iron increases. The total iron requirement in pregnancy is approximately 1000 milligrams. 300 milligrams go for the baby, 400 milligrams for the red blood cells of the mother, and 200 milligrams is the loss of iron which happens through stool and other roots of the body. In practice, Indian women are prescribed iron right from the beginning of pregnancy, especially more commonly after the first trimester. Iron intake is also there in meat products, seafood, poultry, and green vegetables like spinach, legumes, pumpkins, seeds, dried fruits, tofu, raisins, all has iron. The third important micronutrient is calcium. Again, the baby's skeletal system is forming, which uses a lot of maternal calcium. So if calcium supplementation is deficient, it can lead to conditions like preeclampsia and eclampsia. Women who chronically consume low amount of calcium, which means less than 500 milligrams a day, may be at risk for morbid conditions in pregnancy. Low calcium intake is also associated with chronic diseases such as diabetes and hypertension, which have negative impact on both the mother and child's health. The fourth important micronutrient is zinc, which has not been given enough importance in the past, but we find that its deficiency during pregnancy may cause preterm birth or even a very prolonged labor. Maternal zinc supplementation might reduce the frequency of diarrhea in childhood for the baby. The last but not the least essential nutrient for a pregnant mother is DHA, docosahexaenoic acid, which is a component of omega-3 fatty acids. DHA is a major good fat in the human brain and eyes. 97% of omega-3 fat in the brain is DHA, and 93% of omega-3 fat is in the retina of the eyes. DHA is important in the growth and development of the baby's eyes and brain, and it is mostly utilized in the last trimester of the pregnancy by the brain and eyes of the growing fetus. Pregnant women are likely to have an increased demand of DHA by 200 milligrams a day. The sources of DHA are egg, fish, salmon, algae, trout, and chives. Thank you very much.